We've been tracking the situation globally very closely, as all of you are aware, and the numbers are continuing to rise very rapidly. Outside of China, the number of cases is doubling every 5 to 7 days. And so we in Singapore are also seeing more imported cases in these recent days. We have seen around 20 in the last 4 days, and many of them are returning residents, Singaporeans, PRs, or long-term pass holders who were overseas and came back to Singapore. And that's why today, with immediate effect, we are putting out an advisory for all Singaporeans to defer non-essential travel abroad to all countries, right? So that's an immediate advisory going out today for all Singaporeans to defer all non-essential travel abroad. Besides those returning from overseas, we have also had a number of cases from ASEAN countries, from our neighbors, including a few that came with the very specific purpose of seeking medical care here. And it is really hard for us to cope with this additional demand during this critical period when our healthcare resources are already stretched. And that's why, for both reasons, firstly on the to manage the number of imported cases, and also to deal with this demand for healthcare services, we have to be tighter on our border control measures. And so from 16th of March 2359, the task force has decided to put in place a new stay-at-home requirement for all travelers coming back from UK, Switzerland, Japan, and ASEAN countries. In other words, anyone with recent travel history in these countries will have to effectively self-quarantine for 14 days at their place of residence. It could be their home or it could be a hotel, and they have to stay there for a full 14 days. For nationals of ASEAN countries, we will have an additional requirement, which is that they will have to submit health information to our overseas missions, and this will have to be approved by the Ministry of Health before they travel. So that's an additional requirement we put in place for nationals of all ASEAN countries. And this requirement will also take effect at the same time as the new 14-day stay-home requirement. We are putting these arrangements in place for the whole of ASEAN, but we do have to put in place some special considerations for Malaysia because of the close proximity and the high interdependency between our two countries. So for now, the arrangements which I've just described will not apply to our sea and land crossings with Malaysia. Right, so all the arrangements that I've described that's in the press statement today will not apply to our sea and land crossings with Malaysia. We do need precautions to be taken at these checkpoints, but it is going to be more complex given the high volume of people moving in and out of these checkpoints. On our land crossing alone, 300,000 people move across the checkpoint every day. So it is more complex. We want precautions to be taken there, and so separate arrangements are being worked out through the bilateral joint working group we have with Malaysia. They are already in discussion, and they will work through separate measures. The other existing travel restrictions we have put in place, specifically to ban all short-term visitors from entering Singapore or transiting through Singapore, we have applied that to a few countries. Those existing travel restrictions remain. So if you look at our travel restrictions and border control, effectively we now have a 3-tier framework. For travelers from countries of highest risk, they will not be allowed entry or transit through Singapore. This is for the short-term visitors. And this would apply to China, France, Germany, Italy, Iran, Republic of Korea, and Spain. Residents and long-term pass holders coming back will be allowed to. For those from Hubei, they will have to serve a 14-day quarantine. The others will have to serve a 14-day stay-at-home notice. And then short-term visitors are not allowed entry or transit. That remains. Today, we are introducing a second tier for countries which are at risk, but we do not think it is necessary to disallow visitors from coming, but we require all of them from these new countries, Japan, Switzerland, UK, and ASEAN countries, to serve a full 14-day stay-at-home notice when they arrive. And then for those coming with the nationals from ASEAN countries, we also require them to submit their health information to our overseas mission as an additional requirement. So that's our second tier. And then, of course, the third tier would be countries that can come without any travel restrictions. And with a more tiered, risk-based framework, that will allow us more flexibility to manage the flows of people coming through our borders, and we can adjust according to the risk situation. Right? Some countries may have no restrictions today. We may have to move them up to the middle tier or even to the top tier later on. Some countries that are in the top tier today, as some of you have asked, if the situation stabilizes, we may very well move them later on to the middle tier or maybe to the lowest tier. Right? So we can escalate or de-escalate depending on our assessment of risk, and that will be based on the data and evidence. But this gives us a more comprehensive and rigorous framework in place to ensure that our border controls remain tight and to allow us to limit the number of imported cases coming into Singapore.